Red eye. Based on MCC objectives, we have different reasons. External structures can cause red eye, like conjunctiva or sclera. In any of the structures, if we have any kind of infections or allergy or inflammation, it can cause red eye. For example, in this area, conjunctivitis or subconjunctival hemorrhage could be the cause of the red eye or pink eye. Also, anterior chamber can be involved, which iris or anterior uvea, in this case uveitis or acute angle closure glaucoma, or it can be involved it can involve orbit or surrounding structures, which could be orbital cellulitis or periseptal cellulitis. Then we go to the history taking section, which is very important. Always when you are entering the room, knock the door, introduce yourself, always wash your hands, and ask patient how they want to be addressed. Then start to ask questions related to the issue with open-ending questions. For example, asking patient, like, tell me more about your issue. Then we ask about the onset, if it was sudden or gradual, if both eyes are involved or just one, if they have any pain, based on the abbreviation that you prefer to use, for example, Socrates or PQRST. Ask further questions about the pain, the quality of pain, timing, if it's constant or intermittent, how long it lasts if it's intermittent, the frequency of the pain, the character of the pain, if there is any radiation, if there is any factor that relieve the pain, if there is anything makes it worse, and asking about the severity of pain in a scale of 1 to 10. Any changes in vision, for example, if they see any halos, if there is blurry vision, if they have like photophobia, if they have any foreign body sensation, if there is any discharge, ask about further about the discharge always, to know what kind of discharge is that. Is that a water discharge, which can caused by an allergic, or it can be purulent, which could be a bacterial conjunctivitis. Always ask about trauma, or if the patient wears contact lens. Also, it's like other history taking associated symptoms is important. For example, if they are experiencing headache, for example in glaucoma, or if they are experiencing any fever, like in infectious diseases, or they have any upper respiratory infection, or if they are in contact with someone who had a red eye. It's important about asking about GI symptoms. For example, in acute angle closure glaucoma, they have nausea or vomiting, or in IBD they experience GI symptoms. It's important to ask about genitourinary symptoms, for example in sexual transmitted infections, for example chlamydia. It can cause also conjunctivitis. Also, like other histories, past medical history or surgical history, family history, drug history, social history is important. For example, if the patient's job is like construction, or they work with wood or metal, with which there is a chance of getting foreign body, it's important to ask all of these things. The most common causes of red eye is conjunctivitis, which could be viral, bacterial, or allergic, or subconjunctival hemorrhage, or even dry eye. There are some causes which are serious, like angle closure glaucoma, or uveitis, or any kind of ulcer in cornea, also orbital cellulitis, which is important to send the patient to ophthalmologist and receiving systemic antibiotic. We should pay attention to if patient has severe pain, if they are losing their vision, if they have photophobia, or they have any issue in moving their eyes, or proptosis. And emergencies here are corneal ulcer, orbital cellulitis, and acute angle closure glaucoma. Now we are going to a 25-year-old male presents with red, itchy eyes for the past 3 days. Take a focus history, perform a relevant physical examination, and sometimes you may discuss your management plan with the patient. Well, in this case, it's important, as we said, to ask about the duration and onset of the issue. For example, in this case, if we ask when did the symptoms start, they would answer 3 days ago. And it's important to ask if they had this before, which patients in this case would say they had this every spring. And about the symptoms and progression, we have to ask, is that both eyes or just one? In this case, both eyes are affected. About the pain, which in this case they have just a mild discomfort but not a severe pain. Asking about itching and burning, which in this case they had severe itching. Any discharge, they had watery and no pause. Any vision changes, they didn't have vision loss, but due to tearing they had some blurriness. We have to ask about triggers and exposures, like if there was any dust, pollen, or pets. In this case, they exposed to pollen, and it get worse outdoor. And asking about the allergies, which they had seasonal allergy, any nasal congestion or sneezing, or postnasal dripping due to seasonal allergies. This person has that. About fever and contact lens, always we should ask, which they didn't have any of them any past medical history, which they had allergic rhinitis, and they are taking antihistamine occasionally. Pain, trauma, and prudent discharge or any photophobia was negative in this case. Now, after taking the history, we can perform a physical examination. Always we should ask about consent, and also always wash our hands before any physical examination, and explain to patient what we are going to do. Then we can start with general inspection, which in this case patient appears well and they didn't have any distress. Then we go to inspection part. We can say like bilateral conjunctival injection, and eyelids are swollen. We may see swelling of conjunctiva or chemosis, and we don't see any ciliary injection, which means there is no uveitis or keratitis. We can pay attention to discharge. We can say the discharge is watery and not purulent secretion, which rules out bacterial conjunctivitis. We can check the eyelids for foreign body, which we couldn't see in this case. Also, it's good practice to check the visual acuity with a Snellen chart, and with a pen light check the pupillary reaction, and at the end also we can check the nasal area because of allergic rhinitis, which we can see like the pale and boggy nasal mucosa and clear discharge. Now with all this information we can make a decision that this is allergic rhinitis. Other differential diagnosis, if they asked, we can tell them like bacterial conjunctivitis or contact dermatitis, but they are less possible. And in this case, if we want to manage the patient, we can advise them to avoid triggers, in this case pollen, dust, or pet dander. Use cold compresses, and avoid rubbing their eyes. Sometimes artificial tears also can be helpful. If these didn't work, we can use pharmacological management, which the first line is a kind of antihistamine. We can start with eye drops, and then oral antihistamine, and it's important to follow up the patient to see if they get better or worse, and if there is any vision changes, or if there was any, tell them that if they have any pain or vision loss, or light cause them uncomfortable, make them uncomfortable, or if they had any purulent discharge, come back to see us. Thank you for listening to this